So good morning to everyone. Welcome to day 3 of the King's Africa Week for 2020, happening also in Black History Month in the United Kingdom and other parts of the world. My name is Shuvai Nyoni, and it is my privilege to welcome you today to this panel entitled Researching COVID-19 and Leadership in Africa in conversation with the African Leadership Center. I'm the director of the African Leadership Center, and I will be co-moderating this panel with Professor Ismail Rashid. Professor Ismail Rashid is a professor of history at in the United States, and he is also a faculty, part of the faculty of the African Leadership Center, and also a mentor. And it's a privilege to share the space today with Prof. Rashid. So welcome, Prof. It's very early for Prof where he is right now, but we're really excited that he was able to join us today. And we look forward to a really incredible 2 hours with you as we go through and hear from various researchers, fellows, students of the African Leadership Center and their research on COVID-19. I will just tell you the names of the panelists, the 4 panelists for our first panel this morning. We have with us Dr. Moses Tofa, who is a research lead and postdoctoral fellow at the African Leadership Center in Nairobi in Kenya. We also have Ms. Mwemwe Fabiano, who is one of the current current cohort members of the fellowship programs of the ALC. We also have Ms. Adeoti Dipiolu, who is a research associate of the African Leadership Center and also a project coordinator of one of our research projects. We have Mr. Hubert Kinkoh, who is a coordinator of our fellowships program and also a research associate at the ALC. I would now like to hand over to Prof. Rashid, who will take us through for the rest, for the rest of this next part of our session. Thank you, Prof. Over to you.
Thank you very much, Shuvai. And first, I want to extend welcome to all of the panelists and all of you who are joining us for this webinar this morning. I hope that you and all of your loved ones are doing well and are managing under what are clearly very difficult circumstances. Our generation is having an extraordinary experience. The last worldwide pandemic that we had of these proportions, as you are all aware, was the influenza pandemic of 1918 and 1919. So we are living through a time from which we would have memories for the rest of our lives. Just a few things, to put out for us to think about and to reflect as the 4 panelists give their presentations, and also as you think of how you want to join this discussion during the question and answer segment. So as we are now speaking, over 40.4 million people have been infected by the COVID-19 virus. About 1.1 million people have died. The country in the world that has the highest case of COVID-19 infections and death, of course, as you're aware, is the United States. Africa has done much better as a continent than the rest of the world. For several people, including scholars, this is a conundrum. This is a paradox. Why is it that a continent that is usually seen as a continent full of all, if not most, if not all of humanity woes, is managing and responding to this pandemic much, much better than countries, including those in Europe and North America, who, which are much more better resourced. And as if you've been following that scholarly discussion, you would know that Several reasons have been put forward. Our demography, Africa is a young continent, the fact that Africans have also become very adept in some cases in terms of responding to various disease epidemics. This was a continent that not too long ago, in the Western portion was dealing with the Ebola epidemic in Central Africa. Again, the Congo has developed really a range of tried and tested methods to respond to something like the Ebola epidemic. So the continent has done relatively well, except for South Africa and Egypt, as you guys are aware, which are two of the outliers. Again, during the discussion, some of that might come up. We have done well in terms of keeping the numbers down in the continent, but one of the things that's also evident, and I know that the panelists will speak to this, are the tremendous social, political, and economic stress that has been placed on the continent. COVID-19 is not only about the number of people that have got infected or the number of people who have died. The COVID pandemic has also been about shutting down economies for various periods of time. And nearly every economy in Africa got shut at particular periods in time. Though if you look at what happened in the continent, those closures tended to be of a shorter duration than other parts of the world. But for most parts of the continent, the big hit is really in terms of decline in economic production and people having resources for their livelihood. And in a number of places, we're beginning to see the impact and those social stress bubble up to the surface. I hope that all of you are following the news of what's going on in Nigeria. I don't think that Nigeria is going to be an exception. The continent should be prepared for some of the consequences, social, political, and economic consequences post-COVID. So thank you very much for being with us this morning in this webinar. We would now open up the panel, and our agreement is that you would present for hopefully 5 to 6 minute maximum, so there would be sufficient time for you to respond to question and answers. For those of you who are participating, please put your questions in the chat box, and we would share those questions with the panelists. So our first presenter would be Dr. Moses Tofa, and then we would go on to Mwemwe, Hubert, and Adioti would close out the panel. So please, 5 to 6 minutes maximum. Moses?
Thank you, Professor Rashid, and thank you, Shuai, and thank you all the panelists and those who are attending the session. I'm going to briefly speak about the lessons which we have learned from the COVID-19 pandemic in Africa. And then I'll speak about what Africa needs to do during this pandemic and after the pandemic, and what is Africa's space in the post-COVID-19 dispensation. So in terms of the lessons we have learned during this pandemic in Africa, is that despite that Africa is a continent which is endowed with natural resources, Africa's response to the COVID-19 pandemic has overly, depended on gifts, donations, and loans from the international community. Now, these gifts and donations are good in the fight against the COVID-19 pandemic, but they are good if they are given in good faith. Some of them are given in good faith, but not all of this assistance is given in good faith. If we take a tour into the past of Africa, you realize that gifts were used in order to negotiate mining concessions, and this is one of the strategies which were used to colonize Africa. So some of these gifts are presented as if they are coming from a place of generosity when they are a tiny percentage of what wealthier countries are extracting from Africa. So we have learned that it is important for Africa to be able to look inward in order to deal with its own problems. And the second lesson we have learned is that, the pandemic has debunked the neoliberalism. It is very disastrous to underinvest in the provision of public goods, especially in health and education. So we have seen the state coming back to play a very fundamental role, which we have not seen in a number of decades. So it is very clear from this pandemic that as Africa and even other countries, there is need to ensure that the state plays a fundamental role, a leading role in the provision of public goods, especially health and education. The provision of these goods cannot be left to market forces. The third lesson, as Professor Rashid has said, that Africa has responded quite better compared to other continents. But if you look at the time that this pandemic started, most of the characterizations of Africa which are out there are anchored to prejudice. It was expected that Africa would be the epicenter of the pandemic and scores of Africans will fall dead on the streets, which did not happen because as a continent, we have managed to respond better than other countries in other continents. And the last lesson we have learned is really about trust and mutuality between the citizens and the state, especially when the state has to mobilize the society to respond to seismic challenges such as the COVID-19 pandemic. And I think the panel which will come after this panel will speak into detail about that issue. So what is it that Africa needs to do during this pandemic and post-pandemic, and how is that going to determine Africa's space in the post-pandemic world order? The first thing that Africa needs to do, I will just mention 3 points for the sake of time. The first thing that Africa needs to do is to move away from the winner takes all politics, which has characterized especially our electoral politics, where the winner gets everything and the loser walks away with nothing or little. And this has reduced our politics to a zero-sum game where they have become a matter of life and death. And the period between elections is characterized by conversations and contestations over, either the past election and the coming election. So we are fixated on the past and the coming elections. And this takes away a lot of attention, from economic activities. If that's what part of I think, of the Building Bridges initiative here in Kenya is trying to do. Of course, there are reservations about issues of inclusivity, but the idea of removing the do or die mentality when it comes to our electoral politics is very, very fundamental going forward. Then the second thing which Africa needs to do is to accelerate the decolonization project. This includes accelerating regional and trade and integration, building infrastructure which connects the continent, and ensuring that people and goods can move from one country and one part of the continent to the other freely, accelerating inter-African trade and cooperation. And in the area of international trade deals, it is very important that Africa negotiates from a united front rather than negotiate as individual states and as small groups. So it is very important that decolonization project is accelerated, especially during this time of COVID-19, when other states are paying attention to their domestic issues. The final point really is about promoting Africa's voice. Now, there are two faces of this particular voice. The first face of this voice is the voice which has to emerge from the conversations and contestations between the state and the society in respect of, the conditions, in respect of how we are supposed to live together, in respect of how we are supposed to be governed, in respect of, citizenship and other issues. Since the attainment of independence in Africa, we have seen these conversations taking place, but we have seen citizens making demands upon the state. One of the important issues which Professor Fumi raised yesterday was that as Africans, we never had, these conversations about the terms on which we have to live together, and we never had them democratically and in a manner which is inclusive. We have witnessed the outbreak of civil wars in the 1990s. And today, this is part of what we are even seeing in Nigeria, the EndSARS protests which are taking place. These are legitimate demands by citizens. This is how we want to be governed, and the manner in which the African state should respond in the 21st century should be different from how it responded in the 1990s, should be different from how it responded as soon as we got independence. It needs to respond to these demands in a manner which is inclusive, which is constructive. That is very fundamental. And then the other face of this voice is really about Africa's voice in international relations, Africa's agency in international relations. Africa needs to play a very important role in the generation, in the deployment, of those norms which are governing the international community. It does not need to continue to be a recipient of norms which are manufactured and peddled by other actors and states. It needs to be able to have a voice. And part of what this voice has to do is also to really undo, to counter the prejudice which is out there in respect of Africa, to tell the story of Africa, and to be able to defend and promote the values of the continent. But it is, it is quite disturbing that we have seen in some African countries, states using the COVID-19 pandemic as a smokescreen behind which to fight political pluralism instead of using this as an opportunity to address all these issues. So as I conclude, Africa's space in the post-pandemic world really depends on what Africa is doing now and what Africa will do in the post-pandemic world. And if Africa does some of these things which I've mentioned, its place in the post-pandemic world will be quite optimistic. But if we continue to repress our citizens, if we continue not to address these issues, our space in the post-pandemic world will be quite pessimistic. Thank you, Professor Rashid. Thank you, Shuai. I end here and I will be able to answer any questions.
Mwemwe.
Right. Thank you, Professor Rashid. Good morning and afternoon, everyone. Thank you for this opportunity. My short presentation reflects on an op-ed or think piece that I wrote earlier this year, titled From Crisis to Opportunity, COVID-19 and Innovation in Africa. This paper was written considering the predominant narrative of Africa and the African context, which tends primarily to be of poverty, illiteracy, bad governance, poor leadership, disease, hunger, and violent conflict, among other things. So in line with this narrative, we find that at the onset of the COVID-19 crisis, and as the crisis peaked, the media was awash with morbid projections about the African continent. Yet, in the middle of these projections and the ongoing crisis, life continued to happen in Africa. Innovations and possible solutions were developed and continue to be offered by Africans. And so it is said that necessity is the mother of invention, but I think that beyond that, it is worth noting that the emerging innovations on the continent highlight the ingenuity, talents, resilience of citizens and communities in Africa, both in normal times as well as in complex emergencies. So for example, from Malawi to Kenya to Senegal, students, university research teams, ICT and health professionals, entrepreneurs, artists, and young people have developed innovations to help prevent, treat, and manage COVID-19. Examples include low-cost ventilators, testing kits, face masks, communication, and digital solutions. The urgency, resilience, and aptitude of Africans for problem solving is exemplified by the diverse innovative solutions that have continually emerged out of Africa, even prior to COVID-19. This includes the bloodless malaria test by Brian Gita of Uganda, the cardiopad by Arthur Zhang of Cameroon, the traffic robots of Kinshasa developed by Therese Izei Kirongozi of Congo, and the monoclonal antibody treatment, which was key to President Trump's treatment from COVID-19 just recently. Dr. Mwemwe Fabiano, who directs the National Institute of the Biomedic Research in the Democratic of Congo, is one of the pivotal figures in making monoclonal antibodies possible. And this was first developed to treat Ebola, which was predominantly one would call a disease of Africa. So all this demonstrates the ingenuity and capacity of African citizens. Moreover, in a global crisis that has isolated countries and disrupted the global supply chain of trade and aid, which Africa mainly depends on, innovative repurposing, reuse, and rapid deployment of Africa's diverse resources and solutions, be it human and natural resources, will remain key for the continent's health security going forward. Hence, innovation is not only related to sophisticated technologies, it can simply be doing things differently or doing different things. And in line with this, we see that the innovative spirit is observed in everyday spaces where men, women, and young people repurpose and transform various products and materials such as plastics, tires, bottles, wires for their livelihood. Unfortunately, most of these innovations tend to be dismissed or overlooked as crude, yet the signposts, the gateways for rethinking and reimagining production and reproduction of various sources in Africa and across the world. And again, I think this is paramount, especially when we start to talk about concepts such as recycling economies. In conclusion, given the existing resource and infrastructure opportunities and constraints in Africa, vis-a-vis the changing global politics, it is paramount that going forward, the African Union member states take deliberate concerted efforts to support and nurture innovation, and I would extend research and development across Africa. It calls for implementing the existing strategies that are gathering dust on shelves and even rethinking where and how we lead solutions in Africa. Thank you very much for listening.
Hello, everyone. Good afternoon. And thank you to the ALC for this opportunity to speak about COVID-19 and the conundrum of China-Africa relations. China-Africa relations has a long history, which can actually be traced as far back as the early 15th century, when Chinese explorer Zheng He made voyages to East Africa, trading rather than conquering, unlike the Europeans. But it is from 2000 onwards that Africa's relationship with China has dramatically risen, owing mainly to China's economic development, military, and other geopolitical engagements with the continent. Now, the outbreak of the COVID-19 pandemic seems to be contributing an important chapter in the history of China-Africa relations. Yet, early analysis of COVID-19's impact on the global political order actually failed to anticipate how the pandemic would reshape China-Africa relations. But what role has COVID-19 played in reshaping these relations? I present three arguments. One, that the pandemic would likely cement ties between Africa and China. At face value, it seems that the pandemic is regarded as one of the key historical junctures that will further strengthen ties between the African continent and China. And anyone barely looking at the fact that China has been at the forefront of providing aid and supporting African nations during the pandemic may be more inclined to taking this position. We all know of the support that the Jack Ma Foundation and the Alibaba Foundation have sent to the continent in terms of millions of testing kits and masks and several thousands of protective suits to African states since mid-March. We are also aware of various ways in which, through video conferencing, China has actually shared knowledge, experience in how they've contained the pandemic back in China with African doctors and leaders from across 54 African countries. Because of these, various African leaders have been quick to express praise, for China, not surprisingly wrapped in the usual mutual support and win-win and friendship language that has actually been the hallmark of modern public relations. Even the African Union has publicly thanked the Jack Ma Foundation and the Alibaba Foundation for their generous donation. However, despite China lending a hand to Africa's coronavirus fight, certain observers have actually made the case that COVID-19 spells doom for China-Africa relations. Hence, the second argument, that the pandemic will inevitably lead to a rupture rather than a strengthening in China-Africa relations. And this argument has gained credence amid, the public fear of the second wave of the pandemic in mid-April, which saw people of African descent become primary suspects as potential sources of the pandemic in Guangzhou, in China, which actually houses the largest African community. The fierce anger, the shock, the indignation that arose from this was manifested on social media. And Africans, leaders and citizens alike, various observers from without the continent, actually vociferously condemned the racism and the discrimination that was targeting Africans in China. Observably and quite uncharacteristically, we saw African leaders responding so swiftly, although hardly protesting China's maltreatment of Africans. We've seen the African Union take lead on that front with ambassadors, African ambassadors in China, calling out the Chinese government against ill treatment of Africans. Now, this is where this argument gets interesting, that predictably, and quite unfortunately so, we found that the responses from African leaders were technical and softly worded. And so despite the talk of a rupture in relations, we notice the fundamentals of the elite level relationship between Africa and China have not been significantly altered by this incident. And from this, a third and more nuanced argument emerged, one that I made together with Dr. Barney Walsh, that the pandemic will rather sharpen and deepen the divide between African citizens and their leaders, and between Africans and the Chinese. As a matter of fact, this is a striking feature in understanding Africa-China relations, the divergent perceptions of China that are held by, on the one hand, the state elite and the many ordinary African citizens on the other. And COVID-19, we observe, is likely to further deepen this skepticism that is held by African citizens towards China and their perceived collaboration with the African ruling elite. We have seen how African citizens' reaction to the Guangzhou incidents the pandemic itself and the view of China as the purveyor of the pandemic contrast sharply with those of their state leaders. More Africans have taken to social media to express pessimism about China's assistance to Africa in the fight against COVID-19. From these three arguments, I can conclude that what is clear is that the pandemic seems to be strengthening China's relations with African states and ruling elite on the one hand, but deepening the fissures between African citizens and their leaders on the other. And the long-term consequences of the pandemic on Africa-China relations are yet to be fully conceived. Thank you.
Good morning, everyone. Good afternoon for those on the continent. It's my pleasure to be here this morning and to be part of this panel with my fellow colleagues at the African Leadership Center to share some of my reflections around diaspora homeland relations and COVID-19. So earlier literature on the diaspora tended to focus on the negative contributions of these actors, especially in light of their roles in conflict, with labels such as peace wreckers or conflict perpetrators attributed to these actors. In all of this, however, there is evidence and recent discourse points to the positive contributions of these actors, more so in times of crisis, how members of these diasporas come together either through lobbying, as we see right now in Nigeria with the case of End SARS, fundraising, or being physically present. Take, for example, during the Ebola crisis, Sierra Leonean doctors and healthcare professionals who returned home to volunteer their services. However, the novel coronavirus has seen a shift in the way these interactions are and may play out in the future. The op-ed piece I wrote looked at the ways in which the emergence of COVID-19 called for reflections on these diaspora homeland relations across three areas: remittances, travel, and expertise of the diaspora. So just briefly, I'll start with remittances. Remittances are a fundamental part of the development of many, if not all, African economies. They help towards economic growth and often make up a notable part of the GDPs of these countries. If you take, for instance, Nigeria in 2018, remittances sent home made up 6.1% of the GDP, which was recorded to be 7 times more than the foreign aid that Nigeria received in 2017. Remittances also help towards development initiatives and other investments that the diaspora often engage with in their homelands. And of course, remittances are the sustainers of the livelihoods of so many families on the African continent. However, the emergence of COVID has seen a downward trend in the flow of remittances, both globally and on the African continent. Globally, a decrease by 20%, and in sub-Saharan Africa, a drop of 23.1%, to $37 billion from $49 billion in 2019. Why has this happened? 2 things. First, of course, during lockdown, the closure of all but essential shops in the UK, for example, meant that many people who rely on sending cash back home were unable to. We see, for example, in the Somali community, who rely on Western Union or Dash Dillies to send this money back home, unable to do so. And second, of course, was the loss of jobs, reduced hours, and impacts financially on the diaspora themselves in many of these Western countries. So what does this mean? This reduction in remittances will have socioeconomic consequences for many people in the African continent, and not least for the fight against poverty, which continues to prevail in many of these countries. However, in all of this, there is a window of opportunity to address forms of money transfers, fees, regulations, which would require conversations between African governments, fintech companies, and financial regulators. So I just now turn to travel and physical interactions of the diaspora. another way in which this relationship can often be explored, with many frequently traveling back home and physically engaging at home. The closure of borders over the past 7 months and reduced air travel made this impossible for so many, and with many having to turn to technology to strengthen and maintain these relationships and existing social cultural connections. Earlier in the year, the loss to the air industry bred fears of exorbitant flights prices, infrequent flights routes to many countries on the continent. Months later, as restrictions have eased, travel starting, we begin to see some of this playing out, albeit with less tension as thought. But however, it does bring newer issues, from having to isolate on arrival or testing, which has price consequences, especially in the West, where private testing is often the best way to get your results on time. I also just want to quickly turn to this idea of a reverse relationship, that is a homeland diaspora relationship. And this reflection comes to light because of the direct impact of COVID on the diaspora, both financially and in terms of the human loss which has been witnessed in the West. Looking, of course, at statistics in the UK and the US, which points to high number of deaths amongst people of ethnic Black origin. So while financial assistance from many of these homelands may be unlikely, support in other forms is not impossible, including using existing formal representation in these host countries to provide support networks for their citizens, or creating formal channels for engagement. There's also a need to just briefly reflect on the fact that the high number of cases in the West and the emergence of COVID on the African continent came from those traveling from many of these outside countries, which of course bred issues of stigma, fears, and people not wanting to return. This of course was shared by a Ghanaian journalist on the BBC, which seemed to be a case in Ghana. But of course there is the issue now that oftentimes people in the diaspora worry about their loved ones in the homelands, yet we saw this reverse of worry coming from those in the homelands about their family and friends in the diaspora. This, of course, can also be seen in the efforts by many governments who arrange flights to repatriate their citizens, as was the case in Nigeria and South Africa, just to name a few. And so, of course, there's much to reflect on this relationship. And this brings me to my final point, which is engaging the expertise of the diaspora. Oftentimes, the diaspora play vital or key roles in times of crisis, especially in terms of their reference or knowledge expertise, where in many cases they have been called upon to provide assistance. This also has been the case during the coronavirus, where Ethiopian doctors and health professionals have shared their expertise through a radio program, or in Nigeria, the provision of medical advice through telemedicine, which was led or has been led by the Association of Nigerian Physicians in America. Oftentimes, this engagement of the diaspora is considered contentious. However, in this time, it offers a reflection as the dynamics from COVID-19 show the potential for access to this knowledge, albeit virtual, time for lessons learning, and the potential key to efforts to address service gaps in many of these countries. What remains unclear, however, is how and will these efforts be scaled up or sustained over the long term. There is, however, hope as we look to adapting technology platforms to minimizing the barriers to increased knowledge transfer. And so in conclusion, ultimately, COVID-19 could strengthen or weaken the relationship and the commitment of the African diaspora to homeland communities, with serious socioeconomic implications for the poorest of the poor. What is very clear, however, is that COVID will and is already changing the relationship between Africans in the diaspora and their homeland countries. Thank you.
Hello, thank you very much, Moses, Chimwemwe, Hubert, and Adioti, for your very, very insightful and rich presentations, which I am sure will generate, hopefully, not only feedback, comments, and questions. As Shuvai and I discussed, maybe we are going to start off by quickly, maybe posing a couple of questions to get the discussion going. And for those who are attending and for other panelists, if you have questions, as we said, please post them on the chat box. So just two questions to start off with. The first going to Moses. Moses, one of the points that you mentioned that I thought was very, very interesting was the possibilities about the directions that the African state can go in terms of getting people not only changing our political culture or political process in many parts of the continent, but opening up new possibilities for citizen-state dialogue. I wanted to ask you, so we definitely see a particular level of trust and mutuality between the states and the ability of the state to mobilize citizens and for citizens to respond to that. So that's a positive. But another area where Africa did very well was the role of community organizations. And we know that community organizations in Africa come in different guises, but what was very clearly effective was the way in which different community organizations played a role in mobilizing support for positive public response to the directives that kept people safe. So what possibilities do you see, especially coming from below, in terms of the citizen organizations and the work that they did and their role in also mobilizing trust and mutuality? How do you see them contributing to that particular process of us or African states moving beyond what you rightly call winner takes all or zero-sum game? The second question that I want to pose is to Chimwemwe. I think Chimwemwe, one of the things that you highlighted, which is normally something that's not highlighted about the continent, were its scientific contributions in the middle of this particular crisis. Then my question is, do you think, what are the ways that you think first that these contributions could be further highlighted? Second, how can they be leveraged by not only the scholars, but also by the continent in two directions. One, to support young people and to get young people to be interested in the field of science and to see that Africans also are the cutting edge of science. Second, how can this also be leveraged in Africa's conversation and dialogue with the world? Over to you, Shuvai.
Thank you very much, Prof. Rashid. I would just add two small questions for Hubert and also for Adeoti. Adeoti, you talked about engaging the expertise of the African diaspora, and in relation to not only responding to COVID-19, but also other pandemics and other challenges on the continent. Could you, what areas would you say they are the most opportunities that could be taken advantage of in this regard? To Hubert, thank you very much for your remarks on China-Africa relations, but especially with respect to COVID-19 and how African states have responded to some of the support. I would like you, Hubert, to just connect some of the points you were making to the observations Moses made regarding gifts, regarding support that the continent has, and if you could if you could outline some of the direction you see this going in, and what could be done differently by African states, but also African citizens. Thank you very much. And sorry, if I could also just encourage you to please put your questions in the Q&A box or even the chat box, and we will put them to the presenters. Thank you so much.
So panelists, you can go with this first round of questions. There's a question in the Q&A box, and then we'll take that on the second round of questions. And please, just very quickly, we're watching time. Please try to be as brief as possible so we can have a second round of questions.
Thank you, Professor. I think citizens' organizations have played a very important role in responding to this pandemic. And in most cases, they have done even better than the state. But of course, they've also been affected because of the lockdown, because of the restrictions. But there are quite a number of factors which really made them able to make the contributions that they have contributed. The first question is really that they are embedded, most of them, in communities. And there is that sense of trust and mutuality between these organizations and the communities in which they operate. They have a better understanding of issues which affect community. They have better relationship with community, and their activities are usually research-led. They are based on knowledge which is driven from research projects. So they have that understanding of communities, and they are more able to respond to these issues. So it is also, but they face the challenge of how, especially the state has responded, especially if those activities are seen, motivated and not really perceived in positive terms with the government. So we have seen a lot of agency coming from those sections of society, from different sections, from different organizations in society. What is important is how do we promote, how do we create the space for the exercise of that agency, which comes from community-based organizations and actors. But I think that's what is fundamental.
Thank you very much. We can move down the list. Mwemwe.
Thank you for your question, Prof. I think the first thing is to implement existing strategies. So for example, in June 2014, the African Union adopted a 10-year strategy titled Science, Technology and Innovation Strategy for Africa. And it's titled On the Wings of Innovation. It was envisioned, and it envisions that science, technology, and innovation are key to the socio-economic development of Africa and the achievement of Agenda 2063. Similarly, in May 2019, the African Union adopted the Health, Research, and Innovation Strategy for Africa. And one thing this strategy emphasizes on is interdisciplinary research that is grounded in context-specific knowledge. And so basically encouraging a concerted approach to research across Africa, but also across disciplines. And this is also seen in a policy brief that was issued by the UNCTAD that actually calls for a wholesome approach to research and solutions. Furthermore, it encourages that, it actually warns that after a disaster, funding for research and development tends to go down. And therefore, any allocation that is made for research, well, firstly, there should be advocacy for research, for allocation of funds towards research and development. And I believe that's a role that both people in the academia and outside the academia can play. And that actually the importance of interdisciplinary research, there is need to move away from compactualization, where we think science is science, engineering is engineering, and social sciences is social sciences, because actually whatever solution that is preferred is actually used in society, and therefore there is need for it emphasizes the need for a wholesome approach. The third thing is leadership, where we have to appreciate that leading a crisis is not business as usual, and leading actually innovation is not business as usual. So I focus on how do we, as I mentioned before, how do we lead solutions? How do we lead innovation? There is need to study that, and that can also only be well understood and enunciated when different disciplines come together, because leadership is understood differently across the disciplines. Finally,
thank you very much, Mwemwe, because at this rate, we would not have all of the answers responded, and we have 5 more questions on the Q&A. So again, Hubert and Adioti, as concisely as you can, so that we can get to the second set of questions before we run out of time.
Thank you, Prof. And thanks, Shivai, for that question. And just to echo Moses' insights, we see Africa has an outward posture, arms outstretched, all the time in its relations with the rest of the world, but notably so with China as well. And what this tells us is that Africa's relation with the rest of the world is mostly transactional. And I think that would be the starting point of the conversation in terms of what direction Africa needs to move towards. Unfortunately, given the magnitude of the continent's debts and what a lot of observers have termed China's special role in the continent's debt relief campaign, it seems as if African governments have found themselves in a situation now where they are between Sheila and Charybdis. They are between a rock and a hard place, having to decide on whose interest to serve, whether to serve the interest of its citizens, to whom they are supposed to play the role of protector, as Plato had emphasized in his Republic, as guardian, that role of guardian, or to try to not bite the fingers that feed it. So given that position, I think it's important, and David Mwambari made this argument that Africa needs to begin looking at itself differently as a partner, in its relationship with the rest of the world. And leadership, the quality of the leadership that is exercised on the continent clearly has a contribution to make in this debate. And a lot of things need to happen. But in the short term, it will be nice to capitalize on the many innovations that African citizens, especially its youth, have actually made visible during this time in preferring solutions to this global pandemic. And I think it's thanks partly to that Africa has not suffered more fatalities than were predicted, as Mwemwe alluded to in her presentation. Thank you.
Thank you very much, Adioti.
Yes, thank you for your question, Shivai. Just briefly, I think, what areas are there for opportunities? So many. I think first and foremost is the need for formal channels to be created, platforms with which these diaspora can be engaged. Of course, across a range of thematic issues from healthcare, and of course, remittances, which will always be the most fundamental way in which the diaspora's power will be harnessed. So I know there are conversations around diaspora bonds. Just for ease of time, I won't go into that. But there have been discussions in the past around that. And these diaspora bonds are meant to help with harnessing the finances of the diaspora towards investment back in the homeland. But also just, I think, engaging the diaspora more and more is what needs to happen. We see so many examples, of course, in Liberia and Somalia, where they have engage the diaspora as part of government structures, giving them positions, and just drawing on their expertise. I'll just give a quick example. I attended a meeting on Monday, which was set up by the Minister for Diaspora, not Minister, the Special Advisor of Diaspora Affairs for Nigeria. And it was basically convening Nigerian diaspora to share their views or share their suggestions towards the National Development Plan, which is in place at the moment. And I just found it quite interesting because, as you know, someone who's now getting to that point in research and academia, I didn't realize that this was a thing. I'm not sure if this was the first time, but it was good to know that they were trying to engage the diaspora in these processes. And you see this in a lot of other countries. And so just to answer your question again, is there are very many areas for engagement of the diaspora. I think fundamentally is the need to create formal structures within which these diaspora can be engaged.
Thank you very much, Adeoti. Right.
Thank you. Thank you very much to our panelists. We have just 3 minutes remaining. And so, Prof, if you will indulge me, I will, I see there are many questions in the chat and specific ones to some specific panelists. What I will request is for panelists to respond within the Q&A chat. But the final question I will put to our panelists is one that was asked to all of them, which was what Africa badly needs if the transformation of governance in all ramifications, what is the prospect of COVID-19 in this regard? So if I could ask you panelists to respond to this question from your vantage point and from what you have shared with us this morning, just in 1 minute to respond to the question relating to transformation of governance in all ramifications, what is the prospect of COVID-19 in this regard? So if you could just in a very short minute respond to that question, and where there have been specific questions directed at you in the chat, please respond to those. Thank you so very much. Let's begin with Hubert, and then we will go to Adeoti, then Chimwemwe, and we'll end with Moses. Thank you.
Thank you very much, Shuvai. About the point on transformation of governance, I think I totally agree. That is what is needed in Africa at the moment. And the prospect of COVID-19 in this regard actually can be seen from the emergent leadership that we've observed across the continent. We've seen citizens actually using social media, for example, and other channels to hold their leaders to account. In fact, and this is largely anecdotal, it seems as though the response at the community level in terms of leadership has largely been led by citizens, those governed, as it were, rather than those who should be governing. But I think that is something that needs to be capitalized upon, and the role of women as well needs to be emphasized. There's a lot of evidence that suggests that a lot of women have taken on the baton of leadership, either at various levels. Actually, the case of the Prime Minister of New Zealand may be actually instructive for Africa, but there are many African women that we can.
Thank you very much.
Yeah, there are many African women and examples of African women that we can actually cite in that regard.
Yep. So let's, because we are almost at the hour, so very quickly.
Yes, thank you so much. How does, from this angle, how does COVID offer the prospect of transformation in governance? I think just from the points I've made earlier, I think is just now figuring out how the diaspora can play a formal role in many of these countries. They've been engaged informally across so many countries. I think now it's finding a way to engage them formally I think Hubert alluded to leadership, and I think is just realizing that not allowing the diaspora as part of these conversations will continue to point to gaps in the transformation of many of these countries, just in terms of course, drawing on their expertise and drawing on their own experiences as members of these communities, but of course, members coming in from the outside with a different set of views that can be fundamentally helpful towards the transformation in many of these countries.
Thank you, Adeoti. Moses?
Thank you, Professor. I see both negative and positive, potential in terms of this transformation. In terms of the negative aspect, COVID-19 has allowed states to use, power, and in most cases to use excessive force. And it is a question of whether after the pandemic, these countries will withdraw that force, they will restrain, they will stop using the power they used during the COVID-19 pandemic. We have seen countries using the pandemic in order to try and restrict fundamental freedoms and rights. Is that going to be the case? Are we going to continue on that path? And on the positive aspect, I think I don't need to overemphasize what my colleague has said, Hubert, about the leadership which has emerged from various constituencies of the society. The question is that something that we are going to sustain in the long run? We have seen the innovation which was taken place. We are seeing a lot of activities being conducted online. That is very fundamental. We've seen parliaments convening, sessions online and all that. That is very important. What is important is to really sustain those kind of improvements. Thank you.
Thank you very much, Moses. And Chimere, take us home.
All right. I agree with my fellow panelists. I think what I can add is that COVID-19 is the one existential threat that has faced all classes and, races, arguably races across the world. And so I think that the level of risk or the level of risk that people are willing to take is going to be different. And there is, I fear that there is a cynicism. And what I mean by that is that for one group of people, COVID-19 has been maybe the first threat that they have really faced in their lives. And for others, this is an ongoing reality of their life, and therefore they are not willing to go forward in the same way, that to live the same life that they've lived this far, and they'll be willing to take extreme measures to make sure that their life is different going forward. So revolution might become part of our everyday, or not everyday experience, but we are likely to experience a change and continue revolution and agitation for change.
Thank you very much, Mwemwe. I think, again, that note that you ended was one of the points that I think that I mentioned at the beginning in terms of sort of social stresses and political stresses that we should be anticipating or preparing for in the continent. So we are going to transition to the next panel, and Shobai would introduce the next panel.
Thank you very much, Prof. And thank you to our previous panel, Chimwemwe, Moses, Hubert, and Adeoti, for those very thought-provoking reflections that you have provided us. I think you've all touched on aspects of leadership, aspects of societal mobilization, and certainly Chimwemwe's last point, I think, gives us a very excellent segue into the next panel,